Hello there, everyone, and welcome back to Dementia Care Source. This is the second video in our series about dementia and swallowing disorders. And back again tonight, I have Miss Megan Martin, who is a SLP, who is specialized in working in dysphagia management, swallowing disorders, and experienced in treating those with dysphagia and dementia. So in the last episode we made, we talked about what dysphagia is. It's just a fancy word for trouble swallowing. We talked about aspiration, what swallow evals and swallow treatment can look like. So if you have not got the chance to see that first video, I would highly recommend it because what we talk about tonight will make a little bit more sense. So make sure to check out that first video. And as always, quick medical disclaimer that any content we go over tonight is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified health professional with any questions you have regarding you or your loved one's medical condition. Don't regard professional medical advice or delay seeking treatment because of something we discuss. We don't recommend or endorse any specific test, procedures, or plans of care, but seek to offer general information and personal insight from our experience and point of view. Okay, so tonight we are mostly going to be talking about diet recommendations. So Megan, just to remind everyone, when SLPs talk about diet, what are we talking about?
So we are not talking about losing weight. We are talking about the texture of the food that you eat. So whether that is soft, like a puree or baby food consistency, or what we refer to as regular, which is a cheeseburger, bread, potato chips, anything and everything in between. We have specific words for, all the different types of textures, which we refer to as diets.
Yes. So you threw out some terms that are kind of old school, and I want us to spend a little bit more time on because we do treat basically in opposite ends of the country. So I'm in Kentucky, which I mention a lot. And so many places here in Kentucky, we're still using some older language for diet textures. So for us, we have regular, which is everything that's your tacos, hamburgers, pork chops. It includes dry and crunchy foods, and then mechanical soft or mech soft, things that you can kind of mash, a lot more like Thanksgiving foods, like turkey shredded up with gravy on it, or oh goodness, like pot roast. If it's cut small, that can be a mechanical soft. Basically doesn't require as much chewing. The puree diet, which I think a lot of people are familiar with, I hate to say it's basically baby food. It's blended up. It's just a solid consistency. And then thickened liquids we'll get to in a bit. But I know that where you are, you said they've actually transitioned to the IDSI diet. IDSI is IDDSI, International Dysphagia Diet Standardization Initiative. So
Yes.
what can you tell us about the IDSI diet where you're at?
So the IDSI diet is an attempt by SLPs across the entire globe to come together and make everybody on the same page. So we all know the same consistencies. And so it's fairly similar. It is the same consistencies and obviously same foods, just a little bit different wording. So we do have levels. Levels 1, 0 through 4 are your liquids getting into solids. And then for us, level 4 is the puree, which is, obviously the same word that we use on the older language. It's this in a medical setting, it's going to be the same foods that you would get otherwise, just blended up with a little bit of milk or juice or chicken broth, just so that it's nice and smooth so you don't have to chew it, like mashed potatoes, applesauce, puddings, that kind of thing. Above that is a level 5, which is minced and moist. So with that, you're going to still get a lot of your vegetables, maybe pureed, but you're going to get your meats really ground up with gravy, and you'll get meatloaf, just chopped up very fine. And your breads are going to be pureed, French toast is still going to be pureed. But you're going to get your meats and vegetables maybe just steamed really soft, so they're really easy to chew, but you do require some chewing. And then above that, you have a level 6, which is soft and bite-sized. So you're going to start getting your breads at that point, just normal, which is great. But your meats are going to be really shredded with gravy or sauce, like a barbecue sauce, like shredded pork or barbecue sauce, or Like you said, like a pot roast with gravy, things like that. And then above that is a level 7, which is regular, which is everything just how it comes, no modifications or anything like that. So same, mostly the same vernacular, just a little bit different.
Yeah. And I think so. I think the biggest difference, just because I know our listeners are from everywhere, the ITSY diet that you were talking about, you mentioned numbers. It has numbers associated with it, and it's color coded as well, right?
Is most, yeah.
So
So
many things.
yes, so it is very helpful, and there are some really great handouts on the different ITSY diet levels. So it's really easy to find information about that and how to modify foods. So I really do like that. Family members are able to kind of look it up easier than in my experience in looking up like the old vernacular terms. So I feel like it's a little more family and patient friendly. So
And so that way, if let's say your mom comes home with a recommendation for a minced and moist diet, that you can kind of look that up. And I think they've even got recipes on there as well. They've got some, well, we'll just move right into it. They've got information on how to thicken liquids, which is just so many emotions, whether you're an SLP or a patient that has been put on thickened liquids, or you've had to be the caregiver of someone that required thickened liquids. It's a lot. We're going to be mostly talking about thickened liquids tonight for the rest of the show. I think when I first asked you about doing this interview, it was, Megan, please help. I am seeing people on the forums and on Facebook groups, people that are not SLPs, let me make that clear, just caregivers who have the absolute best of intentions, but people were kind of just like throwing spaghetti at the wall. We're going to throw it at the wall and see what sticks with thickened liquids. So my take home message, I'll start with my take home message, is that it is unethical to modify a diet unless medically necessary. So I'll let you talk about what you think about that for a little bit.
So I think that is something that's so important for us, especially as SLPs, to remember. We are medical professionals, and as part of that, our job is to provide treatment and provide our best evidence-based practice, which is a fancy term for doing our research, figuring out what works, and making the best choice for our patients. I feel like a lot of medical professionals get a little bit caught up in what's easier, what's expected, or what usually works, and they don't keep current in what's going on and current research, and really updating themselves on the most recent education. And so all of that to say, we want to make sure that everything that we do is medically necessary so that we are not wasting our patients' times or their insurance money, because as we know, anything medical is a little bit expensive. So we do want to make sure everything we do is medically necessary. As you were mentioning, some people are doing this just from home because they've heard it worked for somebody, that it was a good idea for some family member or some friend that they heard about. Oh, that's a good idea, that might help, let's try it. In reality, you can honestly do a lot more harm than good if you don't have the right knowledge and approach and understanding of everything that you're doing. And so getting good solid medical advice before you do anything like change a diet is highly recommended, because if you just do whatever you think is right, that you don't know that it's right for your family member or friend, and that can honestly at the end of the day end up hurting more than helping, depending on what you are doing for them.
Yeah, I think that's it in a nutshell. The number one rule of medicine, right, is do no harm.
Exactly.
That's our number one goal, is we don't want to at least make it worse. So, and I understand, there's so much miscommunication and confusion, even among SLPs, about the ethics behind thickened liquids. So it's not to in any way say, to shame someone if they have been thickening liquids at home. It's just not something, like in the first episode, people don't know about swallows. We don't really know a whole lot about our bodies in general. But just like you said, thickening liquids can be harmful. For some people, it's helpful. For some people, it's more comfortable. It reduces the risk of aspiration, that liquid going in their lungs, but it can cause harm. Sometimes I think it's a little bit easier to liken a swallow to if someone were to break a leg. So if someone breaks a leg, especially an elderly person, sometimes it's really important that they get physical therapy and they do a lot of exercises with their leg, and the leg gets stronger and they're going to walk again. Sometimes if you hurt your leg bad enough, you need to stay off that leg altogether. And if you're non-weight bearing, and if your doctor and your surgeon and your physical therapist are saying, don't put any weight on this leg, I know you want that leg to get better, but you need to not put any weight on that leg, because someone that's their specialty and their skill has that knowledge, has made that recommendation. So I feel like that's the closest analogy I have to thickened liquids.
Yes, exactly.
So
if you break a leg, you're not just going to go start walking on it because, oh, this will probably be fine. You're going to, get it taken care of, get it looked at, get that imaging, and listen to the doctor's order from there.
Yeah, exactly. So that might be the best kind of way to think about thickened liquids. Is it can be the answer for some people, but it is not a catch-all.
Yes.
It is not going to fix everything. In fact, it can make some things worse. We talked about how thickened liquids can actually cause more harm than good. So what are some ways that you, Megan, think about actually thickened liquids causing harm?
Well, that is a great question. So, gosh, in a nutshell, because we don't have 5 hours to discuss this, um, one of the issues with thickened liquids, so for you at home who may have never even heard of thickened liquids before listening to, this session or last session, how on earth do you thicken liquids? What does that even mean? So what is typically used is a cornstarch-based product that kind of sucks up some of the moisture so that it's just a little bit thicker. And some things are naturally a little bit thicker, like a tomato juice, but most of the times when we say thicken liquids, we mean add something like a cornstarch product to it so that it's a little bit thicker. So when you get into that, some of the concerns or some of the possibilities are that if you do aspirate that liquid, you're not only aspirating a pure filtered water, you're also aspirating that cornstarch, which our bodies, your lungs are not meant to digest. They're not meant to accept any kind of food or liquid, but especially the altered ones. Also, thickened liquids have increased pathogenic potency, which is a fancy way of saying that they carry more bacteria and germs, which if they take that, that goes down the wrong pipe into the lungs, then that can definitely lead to more infections than just a simple thin liquid. Also, there has been quite a bit of research regarding thickened liquids as well as thin, and what we call silent aspiration. So when we aspirate, that object goes down our windpipe or our trachea, and the typical human will feel that because we have good sensation, and we will cough. So we are able, hopefully our bodies are wired that way so that we can cough that stuff back up. Unfortunately, not everybody is able to feel that. And so when it goes down the trachea with no response, you don't feel it, you don't cough, you don't try to protect yourself, that's when it's silent. So unfortunately, with thickened liquids, they are more likely to be silently aspirated. So the patient has no feeling of that aspiration versus thin liquids. So even if somebody is like, oh, they're not coughing with thin liquids, it must mean they're not aspirating. We don't really know unless we look inside and do a modified or a FEES in order to visualize what's happening during the swallow. So that is something that I do a lot of education with other medical professionals, such as nurses and doctors, regarding, because um, that is not very well known research. So that's one reason we don't just want to put somebody on thickened liquids, because it really can be harmful.
Yeah. And just to recast that one more time, because that's still something that, like you said, is really new. So new research that's coming out. So SLPs, whenever we're evaluating a swallow, or we look for those overt signs and symptoms of aspiration, clearing your throat and coughing. So what Megan was just saying is that you may have just as much difficulty with the thin regular liquids as you do a thicker modified liquid, but your body is not as good at telling you when you are aspirating the thickened liquids. So you may be coughing less with the thicker liquids, but it's just because your body's not registering that you're aspirating it. So that's what silent aspiration is. So that's very scary. So just because someone's coughing less does not mean that that thickened liquid has cured their swallow. In fact, that can make it way more dangerous to be dumping more liquid in your lungs and have no cough response.
Exactly. No way to protect yourself. That cough is our body's way of saying, hey, this isn't supposed to be here. Let's try to get it out. And with thickened liquids, it's that decreased ability to kind of feel that. And so we're not as protected against it.
Mm-hmm. Absolutely. Another thing with thickened liquids too is we know that it can cause more residue in the throat. So if you think about the pipes in your house, your sinks, if you pour milk or orange juice or water down them, they clean pretty well. But if you were to dump your grease or your gravy, that being the thicker liquid in this analogy, one, that's gross. And two, it's going to be stickier. It's going to clog those pipes because it's thick. So you're going to have more residue, we call it stasis, in the throat, typically the thicker the liquid. And if you are someone with dementia, you are typically going to be an older person. You might have a weaker swallow. You're not going to have as good a squeeze to get all that residue and gunk out of your throat. That's going to put you even at more risk for aspiration. There is a Logeman article. Logeman is one of the gods of speech therapy, if I'm allowed to say that. Very famous researcher, and he had an article in 2008 that demonstrated pretty clearly that, side caveat here too, we've been talking about thicker liquids in general. There are stages of thickened liquids. You have a nectar thick, a honey thick, and a pudding thick. You won't see pudding thick too many places. I'd say nectar is probably the most common. But Logeman's specific research was with honey thick in 2008. And even though it had a lower risk of being aspirated, honey thick is less likely to go in the airway than thin. The patients that did aspirate it had a higher risk of pneumonia, higher incidence of pneumonia, which should make sense from what you were saying, Megan, as far as, if you get a little bit of water in your lungs and your body's more aware because it's a thin liquid and it coughs, you can cough it out. You're showing these overt signs and symptoms with the thin liquid. It makes sense that when you aspirate honey, and we know it has more pathogenic potency, it has more germs in it, it's setting up just almost a domino effect of things going poorly.
Right.
Another issue with thickened liquids that we see is not only if your liquid is thickened, are you likely to drink less of it? I feel like our patients are always complaining that it's gross and that they don't like it. But there's actually a study out there that shows, I don't have the researcher for it, but there's a study that I was reading that shows even for patients where they controlled the amount that they drank, they had so many patients drink this much thin and this much nectar, that even when they were drinking the same amounts, that the ones that were on the thickened liquids had increased signs of dehydration, which I think is so fascinating. And so as SLPs and medical professionals, we're still wondering what that means. But our best guess right now that I've heard talking to colleagues is that our body just doesn't absorb the thickened liquids like it would regular water.
Right. Because we talked about earlier, it has that cornstarch product that is, the intention is to soak up a little bit of the moisture so that it's not quite as thin. But in doing so, does that take away some of that hydration aspect to it? And does that alter how our body accepts it? And, our body basically has to pull that moisture back out of that cornstarch. And so that's something that I've always considered, again, just, an idea of why that's the case. But it's definitely, we do see more dehydration in those patients, as well as malnutrition, because not only is something, if you get a plate of pureed food, doesn't usually look very appetizing. It also, because it is thinned out, or chopped up and things added into it, like, you grind up your chicken and you put in some chicken broth, and then you have, a scoop of that. It's still not quite the same as, a large, chicken breast or something like that. So even though it's the same food, it's not the same nutritionally. And there are research articles out there regarding the caloric intake on a regular diet versus a puree diet, and that you really are offering fewer calories on those altered diets.
Yes, I'm so glad you brought that up too. I know I've got it here with me somewhere, but it talks not only, they looked at regular mechanical soft and puree. So the study's been a while, but it looked at how many, not only calories are lost, but also protein and carbohydrates specifically that are no longer included. They did a puree tray versus a regular tray and looked at, the nutrients of it and how much it changed. Because, you kind of think like, oh, well, it's the chicken, it's just grounded up. But anytime you modify food, you lose nutrition. So yeah, really interesting. Another thing I think you touched on, and I would love for you to talk more about, is if you have a puree tray in front of you, talk about quality of life a little bit there.
Great question. So that's something that I am always considering as a medical professional, as my patient's quality of life, particularly in degenerative diseases that we know it's not a quick fix. There's not really a cure, such as dementia. We know that this is unfortunately what the patient is going to be dealing with for the rest of their life. So how can we help them enjoy that? Quality of life is basically, how is the patient enjoying what they are getting, whether that is in movement or activities or what they're getting to eat and drink, their overall satisfaction with life. So as far as perspective as SLPs, how that comes into play is with diets. And so if somebody is getting served puree, many people, especially patients who do have dementia, who are a little bit more confused, are going to think, oh, they're just giving me baby food. That can come into play in so many different things, because sometimes they might feel like they are being disrespected by not being given real food or being treated like a baby, as well as it just doesn't look good. Mashed potatoes are mashed potatoes, but chicken isn't usually served in a big pile, and it's not ground up usually. And so, with that confusion, it also leads to other things like the respect aspect and their desire to eat, which can mean that they just don't eat as much, which means even less nutrition and that sort of thing.
That makes me think of a quote when I was kind of getting together some of the stuff for tonight. This is Elizabeth Thompson Beckley. It was in the ASHA Leader in 2017, their May edition. The ASHA Leader that's our certifying body as SLPs. And her quote was, "There is fear of negative outcomes, but people forget about the negative outcomes of not being allowed to make a choice." And that just really stuck out to me, because when you're on a puree diet, how much does that limit your choices? If you're sitting down to family Thanksgiving or a birthday lunch, and if you're on a puree diet, how limiting is that, And and we've talked a lot about the trouble with thickened liquids and the trouble with puree diets. There are obvious benefits to diet modification. Some people, it's what they need. Some people, it's what they prefer. Again, like we talked in the first episode, having repeat pneumonias, choking on your food, that's not pleasant. That's not a good quality of life.
With puree, there are obvious negative sides to it. But again, if that's the patient's only option, if they don't have any teeth left and they're not able to chew, and would just be choking if you were to give them something regular, and puree is the only thing that allows them to continue eating, that's better than not eating at all. And so there are those instances where you really do have to, well, with every patient, you do have to just look at the whole patient and see what's the most appropriate and the safest, as well as what would help increase their quality of life. So for some patients, puree might be the only option to eat safely without choking or coughing or having to sit there for an hour to chew one bite, just due to no teeth. And so it might really be the best option for their quality of life. And that's, again, why we need just a holistic approach to look at the whole person and consider every aspect, instead of, just taking one snippet to make all of our decisions.
Yeah. And that's the perfect transition kind of to our last thought of the night, because as much as you and I have talked about the dangers of thickened liquids and the dangers of modified diets, you and I are going to go to work tomorrow and we are going to recommend somebody in Kentucky or California to be in PO, or to be on Nectar Thick, or to be on puree or minced and moist diet where you are. So all that to say is, let that diet recommendation come from a professional. If you're at home, you're taking care of your mom, dad, husband, wife, and you see them choking on their food or choking on their liquids, or they're losing weight, again, malnutrition, dehydration, repeat pneumonia, all these are signs that something could be going on with their swallow. Talk to your doctor. Talk to your doctor. We are out there and SLPs want to help you do that. There are some other parts of the world and even in the country that some occupational therapists are more involved in swallowing. But certainly everywhere that I've worked, as far as dysphagia, swallowing specialist, that's us. That's going to be SLPs. And we will be the SLPs that have to have this conversation with our patients tomorrow of, we recommend this based on your modified, but also carrying with that, what's your quality of life? What's important to you? And that's even harder for our patients with dementia, because they don't always understand and they can't always advocate for themselves. So, as I said earlier, that will lead us to our last point of, if you have a swallow evaluation for you or your loved one and you disagree with the SLP's recommendation, Megan, has someone ever disagreed with you?
Oh, so many times.
So many times. And everyone's going to handle it differently. Every SLP, every doctor is going to handle it differently. It just depends on their point of view and their ethics and their practice. For me, for my patients, if I recommend, let's say we do a modified, I know they're aspirating thin liquids and they're not aspirating nectar. And just depending on their prognosis, whatever, so many things we could go down. I recommend puree and Nectar Thick. I think that's the best thing for them to keep them from aspirating, because that's a big part of our goal as an SLP is to keep stuff from going in people's lungs. And the family disagrees. They say, Mom always loved KFC and she wants to eat her KFC if it kills her. She wants her KFC. So I just wanted to spend a brief few minutes based on my experience. If you do disagree with an SLP's recommendation, first off, that is fine. I am not the food police. I'm not going to come to your house and bust down your door and tell you that you have to give them mashed potatoes until the day they die. That is not what I'm here to do.
Exactly.
That would be way too easy. Instead, I would want to talk to you about the risk. I'd want to say, we know that it gets hung in their throat. If they go home and they have a chicken wing, they could choke and they can turn blue. And it is painful. And that's not something anyone should ever have to experience. I have seen patients choke. I've done the Heimlich. It is not fun. It's very scary. So that is part of an SLP's job, is to be able to sit down with you and talk about why we're recommending what we are. Along with that, if you disagree with the SLP's recommendations, talk to them. You can ask for the report and you can talk to your doctor, especially if you're getting care in the home. It will look a little different if the patient that we're referring to is still in the hospital or in a skilled nursing facility or a nursing home. Then nursing home is where I've probably had the most experience with this. And so where I have been, we would have what we call a care plan. Is that what you all call it out there?
Yes.
Okay. So talk to us a little bit about what a care plan looks like where you are.
So it really just depends on the patient. And it's very based on the diagnoses, the prognosis, and what we think we can do best for that patient. So, I had a patient recently who did have advanced dementia, and the family members were there and present and were advocating that Mom really likes to drink Pepsi. And Pepsi is something that if it is thickened, it loses its carbonation and it does not taste very good. So unfortunately, this patient was aspirating thin liquids consistently, however, was able to manage nectar thick liquids with some compensatory strategies of, just doing very small sips, taking her time, going slow. So from my perspective, it being a little bit thicker was much safer for the patient and reduced her risk of aspiration and overall discomfort and health, and decrease the risk of infection and pneumonias developing in the future. However, the patient's family was very adamant that, Mom would want Pepsi. So that's their personal choice. That's what they want to do. And so to me, that is a quality of life issue where, if Mom wants Pepsi, professionally, I respect that. That's what, she would want. Again, I just provided a lot of education about the different consistencies and what is safest for her and the risks of aspiration and what to watch out for, like if she starts to cough or if she starts to sound wet, that what vocal quality showing us that it's going down the wrong pipe, and just really provided thorough education and talked with the doctor and let them know the situation, and kind of leaving that up to the family to make that choice. Would she want to be, on the safer side, or would she want to drink her Pepsi?
Yeah. So what did the family decide?
They decided to give her Pepsi. And
there you go.
Yeah. So, maybe one day I'll be that lady who just needs her Dr. Pepper and I'll be happy.
Yes. And yeah, so that's the thing is, and I feel like sometimes just as medical professionals in general, when I've been the caretaker, I feel like talking to doctors is so scary and talking to therapists is so scary. And I just never we are busy. When we get to work, we have dozens of patients to see, but our patients also need our total and full attention. If you have questions, please ask me. That is the last thing I want, is for someone to have a conversation with an SLP or any medical professional, and then we leave and they think, what the heck just happened? What did they say? I didn't get any of that. So yeah, that's probably my biggest plug, is even for swallow valve, it is complicated. And ask your questions. If you don't understand, ask us again. If you feel like you fully understand and you don't like our recommendations, you can get a second opinion. Again, in the nursing homes that I work at, we do the care plan meetings. It's kind of a roundtable discussion. So we'll have the nurse, we might have the doctor, the nurse practitioner present. We'll have some medical coordinator present. I might have our rehab director come in, who would be our boss as the SLP. And we just want to make sure that we're all on the same page and we're all working together to make sure that the patient is having a good quality of life. So if you hear something being brought up about their plan of care, care plan, it's nothing to be afraid of. It's someone cares enough about you and your loved one that we want to make sure we're doing the best we can do for them.
Exactly. And that, like you said, we're all on the same page. We're all on the same team. We're working for the betterment of the patient. You know, we want to know the patient and the caregiver's desires and wishes, and how we can form a plan of care around that to get to the desired goal. And again, all work on the same team for the same reason.
Absolutely. Absolutely. I'm looking at my notes to see if there's anything else. We talked about care plan meetings. So yeah, we'll just wrap it up with saying that we want to encourage you all to be informed. That is why we're making these videos at night after our long days of work, before our long days of work tomorrow. We just want to see a better relationship formed between SLPs and the patients and families that we're working with. You know, we're not someone who ever wants to work against you. We just want to work together. And I promise you, your SLP does have the best in mind if they come out after the modified and recommend nectar and puree. But sometimes collaboration is just required for that holistic individual care that is needed and that we all want for ourselves.
Exactly.
Yeah.
That's good.
That's it. We covered a lot, and I feel like we just had to do somersaults the whole time because it's just one thing leads to another, and swallows are complicated. Swallows are real complicated. So I'll do a shameless plug for what we have coming up next. Along the same lines of, if you don't disagree with what an SLP says and you still want your mom to have that Pepsi, we will have a whole episode on avoiding aspiration. So even though we know they're maybe aspirating on an instrumental, some things that you can do to prevent that just at bedside when they're eating. We're also going to be talking about feeding tubes and the recommendation of NPO, or nothing by mouth, and what that means, and also some tricks for getting someone with dementia to eat a little bit more. I feel like that's a very common complaint that we see.
Definitely. Yes, hear it all the time.
Yes, absolutely. Well, thank everyone so much for hanging with us through the whole video, and we'll be posting a new one soon.
Thank you so much, Gina.
Thanks, Megan.